So we talked about the cane. We talked about the two types of cane. Then you have prosthetic and orthotic devices. A prosthetic device is sometimes called a prosthesis. A prosthesis. And they are made for residents to help improve functions. Prostheses are made for residents with missing body parts. The most common prosthetic is artificial eye. You have legs, arms. You have all types of prosthetic devices. If you do not know what a prosthetic device is, you need to write that down. They're made to replace a missing body part. That should be in your small book. Orthotic device, we talked about that. Braces, splints, shoe inserts. They are made to improve or help restore a function of a body part or limb. The brace I wear, that's a orthotic device. It's made to improve a body part. What body part is this brace improving?
Your wrist.
My wrist. It's made to improve function. And they are specifically made. You cannot wear someone else's brace. You need your brace that is specifically fitted for your body, okay? What's a stump? Somebody tell me what a stump is. It's the amount of the body part, the nub. You just said nub. That's left. Once you cut some off. You know how I'm interested in all things science and health. I use a wonder. Y'all ever wonder when they do surgery? I know when they cut all these body parts off.
What they do with it?
Right, what they do with them? They probably burn it.
Yeah.
You think they burn it or bury it?
You want to spread out stuff? They burning it.
They burn it? I don't know. Anybody ever been a surgical tech? No?
Because my papa, he had gangrene in his leg. But at first they started cutting at his toe. Then they started cutting at his other toe. Then they started cutting half of his foot. Then they took the whole foot. Then half of the leg.
Then the whole leg. Eventually.
Being diabetic, that stuff is serious. Like, be careful what you do.
So when it comes to splints, the splint order comes from therapy department, okay? Splints are very specific, and you cannot wear somebody else's splint. You have to wear the splint that was fitted for your body so it's safe and effective. Positioning and seating devices. You have a variety of things. Cushions, supportive chairs, pillows, towel rolls, splints, heel and elbow protector. These are devices used to position residents with limited independent movement in the best functional position while lying or sitting. Now, when it comes to devices, hand devices, oftentimes when we put devices on hands, we do range of motion prior to applying the splint. If I've seen people hands like this, and a part of the therapy order says to range the fingers. Once you range the fingers, wash and dry the palm of the hand. Because if your hand always like this, what's going to be inside of that? Odor. It's going to be sweaty, maybe moist. So you're going to range the fingers, clean, dry it, and then apply the splint. A lot of orders say stuff like that, okay? Elbow protectors. You know how if we haven't talked about heel protectors, patients who are limited with mobility, they often wear heel protectors. And with the heel protectors, you still want to float the heel. You want to float the heels with a pillow, apply a heel protector. And we also have something called elbow protectors. Because the elbow is a bony prominence. Y'all remember how we were talking about areas that are at risk for skin breakdown? The elbows is one of them. And that's why we put elbow protectors on the elbow, okay? Now, wheelchairs. Wheelchairs are very specific. Therapy writes the order for wheelchair. The wheelchair order comes directly from therapy. Everybody cannot have or sit in the same wheelchair. There's nobody in here that. So do you think, I'm looking at you guys, the wheelchair that you would use, Ivory, Shay would not use it. The wheelchair that you would use, Miss Thompson, I would not be able to fit in it. My wheelchair would be too big for everybody. So that's how wheelchairs are very specific. I'm real tall, so my wheelchair will sit high, whereas, who's the shortest person in here?
Me, I'm 5'4".
You 5'4"? What are you?
5'1".
Your wheelchair will sit low. Wheelchairs are very specific, okay? You have high back wheelchair, standard, narrow, wide, regular back, lightweight, regular weight. You have broader chairs, Mary walkers, very specific things when it comes to wheelchairs, okay? Aids for the activities of daily living. Look at figure 2716. These are devices made available to assist residents with ADLs, okay? What part of therapy works with ADLs? OT. Occupational therapy works with fine motor skills and ADLs. So OT will use these devices. These are common devices for the occupational therapy department. You have a sponge with something attached to clean your back. You have a reacher, shoehorn, and a sock assist. The sock assist will help you, the person that can't bend over, put their sock on. And the shoehorn is going to assist them with putting their shoes on as well. Okay? Preventing injuries to residents during functional activities. Most injuries that happen during a resident's activities are caused by improper use of equipment or faulty equipment. You can help prevent these injuries by being observant and talking with other staff about what you observe, okay? Now, y'all ever heard of lock and tag it out of sight? If you have something that's broken, faulty, take a note, put broken on it, piece of paper. Put it on that piece of equipment. And when I say pull it out of sight so nobody can't use it, you don't want anybody to get the faulty equipment and try to use it. So we're going to lock it, tag it out of sight. Always report to your supervisor when something is broken so your supervisor can get the maintenance department to come in and fix it, okay? Now, exercise, range of motion. You have two different types of range of motion. You have active and passive. In the skills today, in the lab, we're going to do passive range of motion and active. Passive range of motion, how many of you guys have seen the range of motion videos? One person. That's sad. What type of mess? What is going on? What y'all be doing at home besides eating and sleeping?
Do you gotta say it like this?
What is going on?
Man.
I'm doing my part. Y'all do y'all part.
You gotta say it like this.
What is going? So,
Oh my.
passive range of motion is when you don't. She ready to say, "Oh my God, Miss Ruthie." Oh my God, Miss Ruthie. So, when you support the limb, you're going to support the arm and range it. When you move it yourself, that's passive range of motion. Active range of motion, if I say, Monique, hold your arm in the air. Put it down, up, down. Thank you. If she can actively participate, that's active range of motion, okay? ROM, range of motion, that acronym. These people, you people. Guidelines for range of motion. Know what type of exercise you're going to do when you go in. Know what type of exercise you're going to do when you go in the room to do it. Anything that's in your way that's going to be difficult, that's going to be in your way, move it. Always explain what you're doing to the resident throughout the whole exercise. And remember your own body mechanics because you have to be safe. Pay attention to your body position, okay? Now,
So active, assisted range of motion.
Don't worry about it. I don't think you should worry about it. But you can write it down.
No, I was gonna add. So that's like assisting.
Right. They can't do it independently, but they're trying. Now, the principles of body mechanics when doing exercises in box 27.1. I would write all those down in your small book. And those principles are: maintain a broad base of support by keeping your feet, 10 to 12 inches apart. The next one is to always bend at your knees and not at your back. Keep your back in a neutral position and turn your whole body as a unit instead of twisting, okay? And that's how you're going to protect yourself. It's so hot in here. It's 77 degrees in here. Now, when you are doing range of motion on a resident and you are performing it, you want to keep both hands on the person's extremity during the exercise. You have to be supportive. Y'all going to go back there in that lab. I swear y'all going to do range of motion on each other like y'all Buicks. I'm like, man, that's a whole person, not a Buick. Y'all going to do it so quick and rough. But you got to be swift with it. You got to be conscious that, hey, this person is elderly. They probably have arthritis, stiff joints. If you're ever doing range of motion and somebody screams out in pain, you have to stop. You have to stop and report it to the nurse. You do not proceed. You always stop, okay? Always do the full exercise routine at least once a day. And make sure to tell the resident what you're doing with each movement. And you have to count. When we do range of motion, we do reps, and we always count. Okay, Miss Smith, I'm about to do your upper body range of motion. I'm going to do 2 reps of 3. If at any point you experience pain, please let me know. Because if Miss Smith starts to experience pain, we're going to stop, okay? Now, if there are no restrictions, we move each joint through its full available range at least once a day. In your book, you have the motions of major joints. The shoulder is flexion and extension, abduction and adduction, and internal rotation, external. I'm not going to go over all those, but you see them in the book. Now, the last thing, my hand itching. That means I'm about to get some money, right? Yeah, I'm going to buy everybody a coffee. Buy you a calendar?
Yeah, buy me one.
Absolutely. I got one up here for $8 for next year. I already got my next year calendar. I'm telling y'all, I'm on point with that bit. I'm going to make it my business to keep my business straight. And y'all should do the same. Now, walking. When you are, so the term gait is how you walk. Gait refers to how you walk. How some people are bow-legged, pad-toe, pigeon-toe. You know, we have all types of terms, but gait means how you walk. Therapy will give you an order as far as ambulation. What does ambulation mean? Walking. If you don't know that, or if you didn't know that ambulate means to walk, I want you to write that down. So the therapist's order would say, Ms. Smith needs to walk maybe 100 feet, 5 days a week, 100 feet. And that's going to come from physical therapy because they deal with mobility. So you have to walk her 100 feet. You will count and you will use a gait belt. The gait belt will go around her waist. You need to at least put 2 fingers in the gait belt, okay? You're going to put one hand on each side of Miss Smith. You're going to go under. You're going to either be knee to knee or toe to toe. Going to make it safe. And you're going to squat, okay? Are y'all paying attention? I done lost 2 of y'all. Gone.
But we still, I know we ain't on the first spot. I just need to see you talk.
You need to pay attention.
I had walked out here before when you said.
So I walked out on the bottom of the
I don't know what you did before right now.
Emily.
Who needs some chocolate or some water? Go get some. Go get some chocolate. Yeah, get some chocolate, water, caffeine, something. Y'all got a break in 30 minutes. Wake up. Okay. So. Oh. It don't matter. Just bring her some chocolate. So when you walking your patient, you're gonna say, okay, Miss Smith, you're gonna be knee to knee or toe to toe. You're gonna be on the side, Ivory, okay? Your hands go under. You only got 2 finger space in the gait belt. You want her to cross her arms. If you get her to cross her arms, they'll be out of the way. And so you're gonna get in a stationary position. So when she stands, you're gonna stand. You're only there for support, okay? A person who can ambulate with the gait belt, they can walk. So you don't need to pull them up. Students make the mistake of doing the gait belt thinking they pull. You don't pull, they can stand. As soon as she stands, you're gonna ask her, are you dizzy, are you okay? Because sometimes when people stand, they go through something called orthostatic. What that girl got in that cup, that don't even look right. That lady, ooh, go on, take it to her.
You go right
Okay.
What you say the mom don't like to do?
Leave me alone, talk about my mama. So, no, when they stand up, people go through something called orthostatic hypertension. And that means your blood pressure drop real quick. And you know how we were just talking about the cardiovascular system? And we were talking about how there's a certain area in the heart that gets worn out over time. And it causes you to get dizzy when you stand. That's what happens. So as soon as they stand, you're going to always ask them, are you dizzy? Are you okay? If they're dizzy, you're going to sit them back down. If they're not, they're going to stand. And then you're going to shift to the side. Get them to put their hands down. And you're going to have one hand on the side, one hand in the back. And then you're going to walk them 10 feet, okay? Absolutely. Right there. As soon as you walk in to your left. See them. As long as they're okay, then you're going to walk them there 10 feet, okay? Now, when it comes to walking them with oxygen, we don't do that. Because y'all need to be focused on walking the patient and safety. You're not going to pull the oxygen also. So if the patient has oxygen, you will get another staff member to come in and help you pull the oxygen while you focus on ambulation and the patient's safety. And that's it for this chapter. In this chapter, we learned how and talked about how to promote independence, how to help with various kinds of equipment that promote independence, how to perform restorative activities, including range of motion, and how to assist a resident with walking. So name some assistive devices. They are what? Assist, walkers, canes, what else? Splints, braces. They do have built-up spoons and built-up. We talked about that built-up. It is assist. It does assist with ambulation, yeah. Now, orthotic devices, what are they? They help restore function. Braces, splints, and shoe inserts. Now, what's a prosthetic device? A device made to replace a missing body part, okay? Principles, or let's do the guidelines for range of motion. Know the type of exercise. When you're doing range of motion, always explain what you're doing. Keep both hands in a supportive position on the extremity, one hand above and the other hand below the joint. And do the full exercise routine at least once a day, okay? Now, the principles of body mechanics. We talked about this. Maintain a broad base of support by keeping your feet 10 to 12 inches apart. Always bend at your knees and not at your back. Keep your back in a neutral position and turn your whole body as a unit instead of twisting. Y'all wrote this down? Y'all wrote this down. You need. What's the most important thing always?
Patient safety.
Patient safety is always the most important thing. Y'all go ahead and take the test.